Gina? That's a cool outfit. I told you earlier. We all jump through hoops, right? Want to thank everyone for coming out today and visiting with us as we're addressing the nation's opioid and meth epidemics that have taken the lives of hundreds of our fellow Kansans. And in fact, today, President Trump is also holding a summit on this issue as well. I was in Washington earlier this week, met with Secretary Alex Azar, who's the Secretary of HHS, and also some U.S. Senate leaders as well, as we were discussing this issue that is affecting all of the United States, but Kansas as well. Substance use disorders not only damage the lives of those who suffer from them, but you have the ripple effects that affect every family member, their friends, their coworkers, their jobs, and their entire communities. In my own medical practice, I've seen firsthand the impact of substance abuse disorders. I've had patients die. I have had patients see their lives ruined, and I've also seen them recover as well. I think it is a great opportunity for us, and we have to deal with this issue. I recently heard the story of a young man here in Kansas who felt like he wanted to die, and that the best way out was through the pills locked in his father's cabinet. He cut the lock, and unfortunately, he took all of those painkillers. This young man was eventually found, and his neighbors in a neighbor friend's bathroom found him and got him to recovery. And today, he made it through that ordeal alive. This young man has got himself to a clean living house. He has to deal with this issue forever, but his life is now on the right track. The CDC estimates that 115 Americans die every single day from opioid overdoses. We lost 42,000 Americans from opioid and heroin overdoses in 2016 alone. And 2 million people nationwide suffer from some form of substance abuse. The opioid epidemic, and I will add the meth epidemic, is in this country, and it is very real. And it is also real in Kansas. According to KDHE, our state had 35 overdose deaths involving opioids in 2000. That number has climbed to 159 just in 2016. Opioid and heroin addictions are destroying communities, families, and wreaking havoc on our workplace. So I brought the heads of several of our cabinet agencies here today, and also our legislative leaders, because each of these departments and each of these individuals deal with this issue in some way or another. We have representatives from the Department of Corrections, the Department of Children and Families, the Department of Health and Environment, the Department for Aging and Disability Services, and others. Each of these departments have resources that are dedicated to caring for and rehabilitating people with those dealing with substance use disorders. And they are also caring for and supporting those whose lives have been affected by this scourge. We are all committed to eradicating substance use disorders in our state. And that's why I'm here today to sign an executive order that will be a task force to address substance use disorders. The purpose of the task force is to first gather information regarding substance use disorder within the state of Kansas. We want to talk particularly about the growing number of opioid and heroin and meth overdoses in our state and the continued scourge of methamphetamine addiction. We want to evaluate and leverage our existing resources and our existing tools and initiatives that we have already started here in Kansas. There's especially good work that has come from the Kansas Prescription Drug and Opioid Advisory Committee, but we need to go beyond that. We will also be investigating various response options, including distributing naloxone to first responders, more comprehensively utilizing prescription data, and otherwise revising state policies as appropriate. We are going to look at best practices and look for Kansas solutions for prevention, for treatment, and recovery for all Kansans. Ultimately, this committee will make recommendations to the governor and to the legislature, and they will assist in implementing and executing a statewide response. The task force will be chaired by Dr. Greg Lakin, the Chief Medical Officer of the state. Greg? And we will have the heads of 16 different state agencies, experts in medical and law enforcement fields, and members chosen by the leadership of both parties of the House and Senate. So we've had some great examples of this. Senator Wagle has suggested that we need to make sure that we have Kansans who are in recovery from opioid involved in this task force, and we will definitely include them. Over the next 6 months, I expect this group to gather all the information they can on why this is happening and what we can do about it here in Kansas. They will be looking at what resources we have, whether they're effective enough, and where can we improve. We need to take this epidemic seriously. We need to get to the bottom of it. We need to deal with it. And additionally, we're going to make sure that we have the best practices at stake, that we learn and listen from our neighbors across the United States. But what is the best solution for our Kansans? So I look forward to visiting and working with you, and we will be signing this executive order. And then I would like to ask several of the leaders here to speak for a moment. So, do we have some pens? Ah, great.
Grab this up and get the chair.
Okay. We're going to do it in the chair? All right. Okay. Okay. This is Executive Order 1809. And that is signed. Be handing out some of the pens, but I'd like to ask Dr. Greg Lakin to first speak. And he is the new chair of the task force. Dr. Lakin. Actually, let me introduce a couple of other things. He is especially important for this because not only is he a physician and an attorney, but he's also an addiction specialist. And we're very unique to have Greg's unique skills for us. Thank you, Greg.
Thank you very much. I am honored. No, I've been treating substance abuse addiction for the last 25 years, both inpatient and outpatient. Certainly, I had a keen interest in how to manage, this disorder, and so I am honored to actually, be head of an incredible task force that really involves a group that is empowered and will put a plan forth that will really, I think, not only improve lives, but will save Kansas lives as well. So, thank you very much, and I'll get to work.
Great. Thank you, Greg. Thank you. Senator Wagle, would you be kind enough?
Well, first of all, I'd like to thank Governor Collier for listening and for leading on this issue. And certainly, I'm very proud of President Trump, who understands that we are experiencing an epidemic, and he's raising national awareness right now as to the importance of addressing these concerns. In Sedgwick County, we have a task force that's been put together of our sheriff, our police, our healthcare providers, our hospitals, our mental health workers, and we are anxious to be working with the governor on finding solutions. Clearly, we have recognized that jail is not the place for someone who has an addictions problem. And the earlier you can intervene and get therapy to an addict, the more likely you are that that person recovers and becomes a productive person in our society. So I'm very pleased with all you're doing, Governor, and really appreciate your effort in this area.
Appreciate your leadership.
Yeah, I would just echo what the Senate President said. I'm thankful that Governor Collier got out in front of this problem. It's real, it's here, it needs to be addressed, and it appears that he's getting the right people on the committee to actually get something accomplished and start diminishing this terrible problem. So thank you very much.
Thank you. Majority Leader Don Heineman. Thanks, Don.
Well, Governor, I want to thank you for taking this initiative. This really is an emerging issue that continues to grow. Obviously, it affects the individuals who are suffering and battling addiction, but it affects state budget through various programs that are impacted by their addiction. It affects their family. It affects the economy of the state of Kansas. So it's a growing and emerging problem, and we need to get ahead of it. The time is now, and I thank Governor Collier for his leadership on this issue. Thank you.
Representative Brenda Landwehr.
Thank you, Governor. This has been an issue that I have followed for several years, and I've had the privilege to work with Dr. Lakin and Dr. State Representative John Epley in trying to learn a little bit more about this, and I was very appreciative of the help from the Kansas Health Foundation to learn about some of the different things that we need to do. And last week, the House introduced a bill that will add to our K-TRAC system, veterinarians, because it was disheartening to find out the number of opioids that we actually have them starting to prescribe, and they're also dispensers. And we are working in several areas of how to enhance our K-TRAC program. Kansas was one of the first states to actually start tracking some of these medications, so we're way ahead of the curve. And our idea is to be able to keep from having a crisis in this state, because I don't believe that we're there, but we could definitely get there very quick if we don't get our handle on it. So thank you very much, Governor.
Anybody else like to say something? Okay. I think we would be happy to take a couple of questions on the topic, if anybody would like.
What can the states do to increase the use of the K-TRAC system?
Sure. Who wants to address that?
I probably should let the pharmacy board.
Yeah.
You know,
Come on.
Thank you. I'm Alexandra Blasi. I'm the executive director for the Board of Pharmacy, which is home to the prescription drug monitoring program, which we call K-TRACs. One of the unique things we're doing is that we are the subrecipient of a CDC grant through the Kansas Department of Health and Environment to bring statewide integration of K-TRACs data into the electronic health record systems for all hospitals, clinics, pharmacies across the state. And so that gives us the opportunity to integrate into the clinical workflow, save providers time, and really direct their attention to the whole patient as they're looking at all of the metrics from a patient's blood pressure to their prescription history.
Dr. Lincoln, you're relatively new to your position. I was kind of curious, how would you bring access in Kansas to substance abuse treatments right now, especially for lower income individuals?
You know, there are all kinds of different programs out there, inpatient and outpatient. I think we're starting to, with telemedicine, with the use of Suboxone and other, methadone would be another medical type of treatment. I think we're doing pretty well. Could we withstand a big surge like Ohio or New Hampshire? We're not ready for that yet, but we will be ready. Hopefully we can prevent it. And that's really where the key is in prevention.
In addition, we're looking for a waiver. There are some federal guidelines that say that the number of beds are limited to 16. And so we are looking at some waivers from CMS on that issue.
Question for anybody. How much of the problem in Kansas is due to prescription opioids and
Can I say something on that?
Yeah.
In meeting with my healthcare providers and the police and sheriffs in Wichita, we think our number one problem is meth. So that's an illegal substance that's not obtained by prescription, but it's horrific on how quickly it destroys a life. So, but we do understand the opioids are a different situation. They're prescribed.
And the other thing that's happening, and I agree with her, the meth issue, and that's why we are specifically, talking about that, is something that does affect all across Kansas. Opioids, we are also starting to see more heroin coming in. One of the things that's happening in other states is that as the prescription use has changed, is being substituted by heroin going in. And so we need law enforcement and everybody involved in this. This is not a simple question.
Under little interim steps, like people who have opioid addictions, like maybe they shouldn't sell guns or give them a restricted driver's license, right? Is there anything interim in there that we ought to be doing?
No, we have a number of things right now that we are already doing for people that have substance abuse, that there's some coverage under CanCare, for example. trying to get referrals out, and maybe actually could you talk about maybe the mental health centers and some of the things that you guys are doing?
Yeah, so care coordination is a piece of CanCare, which I think was intended in CanCare 2.0 to be amplified, but going back to something like health homes and being able to monitor prescription drugs is a huge part of care coordination and being able to treat the whole person who they may suffer from chronic pain, but they may also have an anxiety disorder. So if we can treat the whole person, then we'll have a lot more success and we'll avoid being a cautionary tale like states like West Virginia or Ohio, and we can be a leader in this.
Who else? Okay. Well, we want to thank you. We want to thank the team here today, and we look forward to updating you on this periodically, and we look forward to the task force and their recommendations. Thank you.